What if I told you that for many people, type 2 diabetes isn't a lifelong sentence of medications? As a clinical pharmacist, I've seen patients completely transform their diabetes through methods that weren't always discussed in their initial care plans. Hey everyone, I'm Dominique, a clinical pharmacist with years of experience helping people understand and manage their diabetes. If you've been diagnosed with type 2 diabetes and you're wondering if there's another way besides pills and injections, this video is specifically for you. By the end, you'll understand exactly what's happening in your body and have a clear picture of whether you can safely try the natural approach. Type 2 diabetes just isn't about having too much sugar. It's about insulin resistance. And insulin is a hormone made by the pancreas and plays a huge role in how your body uses blood sugar for energy. Think of insulin as the key that unlocks your cells so glucose can enter and be used for energy. When you eat food, especially carbs, your body breaks it down into glucose, which enters into your bloodstream. Normally, insulin comes along, unlocks the cells, and lets that glucose in to be used for energy. But with type 2 diabetes, your cells are essentially changing the locks. The insulin key doesn't work as well anymore, and this continues to progress over time if not managed. So glucose eventually can't get into your tissues and cells and ends up accumulating in your blood. Over time, persistently high blood sugar levels damage several organ systems such as the heart, the kidneys, the eyes, and more. That's why doctors are so quick to prescribe medication. They want to prevent this damage. But here's what many doctors don't emphasize enough. In many cases, especially early on, you can actually reverse this insulin resistance through lifestyle changes alone. The insulin resistance we see in type 2 diabetes usually develops in those who have a lifestyle that consists of overconsumption of processed foods, minimal exercise, and also genetic factors play a part. But, and this is the crucial part, your body has an amazing ability to heal and adapt when you give it the right environment. Combined dietary modification with increased physical activity have produced clinically significant rates of diabetes remission. The key factors: sustained weight loss and improvement in your body's ability to both produce insulin effectively and use it more efficiently. This isn't my opinion. This has actually been studied and proven by randomized controlled trials and other medical studies. The clinical findings support that diet-induced weight loss and structured lifestyle interventions such as regular exercise can actually result in remission of type 2 diabetes. These intensive interventions are particularly effective for people with shorter disease duration, meaning those who have been diagnosed more recently. You have an even better chance of achieving remission. Now, let me be clear about what remission means. It's defined as achieving an A1C value of less than 6.5% for at least 3 months after stopping all diabetes medications. We're talking about reversing diabetes to the point where you no longer need any pharmaceutical management. For those of you who are like, what is an A1C? Or some of you may have been getting this test but didn't really know what it was measuring. Well, the A1C test is a blood test that measures your average blood sugar levels over the past 3 months and determines your personal risk for poor health outcomes. And there are 3 ranges of A1C classification. So a normal A1C would fall between 4 and 5.6%. We consider someone to be pre-diabetic if they have an A1C ranging between 5.7 and 6.4. And those with an A1C of 6.5% or greater are classified as having diabetes. Because the data shows that maintaining an A1C below 7% significantly reduces the risk of diabetes-related complications, such as kidney disease and blindness, the goal for most people is to keep their A1C below 7%. However, this goal can vary from person to person based on various factors like age, fragility, and the presence of other health conditions like the history of heart attacks and strokes. You and your doctor should be discussing these things during your appointments. If your A1C right now is far away from 7%, please don't feel discouraged because you can still make huge strides in your health by lowering your A1C just by 1%. The landmark UK PDS study showed that every 1% drop in A1C reduces the risk of microvascular complications by 37%. And what I mean by microvascular is I'm referring to the smaller blood vessels that supply blood flow to important organs like your kidneys and your eyes. All of this brings me to a big point that I want to make. The reason why healthcare providers are quick to recommend starting a medication if your A1C is greater than 6.5% is because we know what happens if you don't get your blood blood sugar under control fast. And because type 2 diabetes is largely driven by behavioral factors like poor diet and inactivity, most people being diagnosed are not willing to address the root of the issue, such as their diet and sedentary lifestyle. This is why treating diabetes naturally should be isolated to those who are willing to lock in and make these changes. But for the average person, the diabetes guidelines recommends to start medications for A1Cs 6.5% or higher. Now, I want to be very clear that guideline recommendations are just that, recommendations, which means that if you and your doctor get together and create a plan and decide that even if your A1C is greater than 7.5%, that you are still a good candidate to try this without medications, then please go for it. But if you are having symptoms and signs of organ damage, it might be a good idea to start a medication to make sure we give your pancreas a break and slow down that progression of damage. I know you didn't come here for bad news, so let me give you the good news right away. The encouraging part is many people who get started on medications were able to reduce or even eliminate them once they made consistent lifestyle changes. I will even give you an example of a patient that I have seen this happen for. He started with an A1C of over 7% and he was prescribed the lowest dose of metformin. But after implementing the exact strategies I'll share in this series, his next A1C dropped to 6.1% in just 90 days. And if he keeps this up, he could very well be able to come off metformin completely. The key to understand is this: the longer you wait, the harder it becomes to reverse diabetes. Your pancreas can only compensate for so long before it starts to burn out. And your organs and your blood vessels can only take so much damage before they start to give out as well. Now, I think the next biggest question is, how do you manage diabetes naturally? Okay, we know that they're going to say,
eat better and exercise.
But is that sufficient knowledge for you to really be successful at this? Well, I'm going to cover the exact strategies for food and exercise in my next videos. This is actually the first video of a 3-part series of how we can approach our diabetes management naturally. This is going to be for folks who don't want to take medications at all, but it's also going to service those who are on medications and those who are pre-diabetic, who are trying to prevent themselves from progressing into diabetes. In my next video, I'm going to break down which foods actually stabilize or spike your blood sugar. Some might surprise you. The meal timing strategy that reduces blood sugar spikes by up to 40%. And the simple plate method that makes this easy to implement every day without having to count carbs or calories. So if you want to see that video as soon as it drops, make sure you hit the subscribe and turn on the notifications. I'd also love to know where you're starting from. So drop a comment below with your current diabetes journey if you are comfortable sharing. If you found this information helpful, please give this video a thumbs up so more people with diabetes can discover these options. And you might want to share this video with somebody it would benefit. Thank you for watching. Stay blessed and stay curious. Bye.